Hey there, everyone. Today, we're diving into a topic that's both eye-opening and controversial: the impact of President Trump's Medicaid work requirements on Nebraskans. Now, I know what you might be thinking, but bear with me as I take you on a journey through the complexities of healthcare policy and its real-world consequences. So get comfy, grab your snacks, and let's explore this together. First things first, let's talk about the basics. Medicaid, for those of you who might not be familiar, is a federal and state program that provides health coverage to low-income individuals and families. Now, under President Trump's 2025 big budget law, states were given the green light to implement work requirements for Medicaid recipients. And guess what? Nebraska is the first to take the plunge. Now, I find this whole situation fascinating for a few reasons. Firstly, it's a prime example of how policy can have a direct impact on people's lives. These work requirements are not just numbers on a page. They're real people facing real consequences. Secondly, it highlights the tension between federal and state powers in healthcare. States are now in the driver's seat when it comes to implementing these requirements, which raises some interesting questions about accountability and access to care. Now, let's zoom in on Nebraska. The state's Medicaid director, Gonshorowski, is confident that the state is well prepared to handle the rollout. He believes that these new rules will help people move towards economic stability, which is a noble goal, right? But here's the catch. Opponents argue that previous work requirement policies haven't exactly lived up to the hype. Research suggests that they don't lead to more people getting jobs, and many people who lost coverage were either unaware of the rules or struggled with the paperwork. Now, here's where things get interesting. Nebraska claims that it's well positioned to handle the rollout because it runs its own eligibility system. This means they can confirm compliance without asking for additional information, which sounds efficient, right? But here's the catch. Advocates like Amy Binke from the Health Center Association of Nebraska say the state's notices were confusing and left many low-income people uncertain if the new rules apply to them. And let me tell you, this is a huge deal. Now, let's talk about the numbers. Nebraska estimates that around 200 Nebraskans will lose their Medicaid coverage on August 1st. But here's the kicker. Estimates for the number of people who will lose coverage nationwide range from 3 million to 8.6 million by 2028. That's a lot of people, and it raises some serious questions about the impact of these policies on vulnerable populations. Now, here's where things get personal. I can't help but think about the people who will be affected by these work requirements. What's it like for them to receive a letter, text, or email informing them that they're no longer eligible for Medicaid? How do they navigate the complex process of appealing their termination and seeking fair hearings? And what happens if they fall through the cracks? These are the questions that keep me up at night. Now, let's talk about the bigger picture. Medicaid work requirements are part of a broader trend in healthcare policy. They're a reflection of a growing movement towards work-based welfare programs, which aim to encourage self-sufficiency and reduce reliance on government assistance. But here's the catch. These programs often overlook the unique challenges faced by low-income individuals, such as lack of access to transportation, childcare, and job training. Now, here's my take on it. Personally, I think that while the goal of promoting self-sufficiency is commendable, the implementation of work requirements in Medicaid is flawed. It's a one-size-fits-all approach that doesn't account for the diverse needs and circumstances of low-income individuals. And let me tell you, this is a huge problem. Now, here's the thing. I believe that healthcare policy should be designed to support people in their journey towards economic stability, not just push them towards the workforce. It's a delicate balance, and I think we need to be more mindful of the potential consequences of these policies on vulnerable populations. So what do you think? How do we strike the right balance between promoting self-sufficiency and ensuring access to care for all? In conclusion, the impact of President Trump's Medicaid work requirements on Nebraskans is a complex and multifaceted issue. It's a reflection of the challenges and opportunities that arise when federal and state powers collide in healthcare policy. And let me tell you, it's a topic that deserves our attention and reflection. So what do you think? How do we navigate the complexities of healthcare policy and ensure that everyone has access to the care they need?